Hi everyone. I want to take these few minutes to record this video so I can give some context to the drugs that you will be studying for the next week's quiz. I'm sorry for uploading this a little bit later than I meant to upload. So I categorize these drugs into a subgroup, into some subgroups that make sense to me. So hopefully this makes sense to you as well. So the first group I have here are called NSAIDs, and I think many of you should have heard this term before. So it stands for um, non-steroidal anti-inflammatory drugs, and the name is coming from its history that it wanted to be distinguished from steroids, and especially when at the times and sometimes even now that steroids have a little bit of a negative connotation to it because of anabolic steroids abuse. So they are similar to steroids in terms of their anti-inflammatory effects, but then has many other things such as reducing pain, fever, and also blood clots, and also inflammation, of course. And but anti-inflammatory effect is more with higher doses. And then there are three drugs in this week's quiz. First one is celecoxib, and brand name is Celebrex, and it is known for cyclooxygenase 2 inhibitor, or a lot of time you'll see them as COX 2 selective. So this means most of the NSAIDs, their activity is by inhibiting both COX-1 and COX-2. So those are considered non-selective agents. So the common one you see under NSAIDs, such as ibuprofen or naproxen, they are considered to be non-selective. So every NSAID has different selectivity, and the reason that we sometimes want to use this COX-2 selective agent is because they have less GI bleeding or ulcers. So basically less GI side effects when it's more selective for COX-2, because COX-2 are the when they are inhibited, they increase a risk. They are not producing the coating that is needed for stomach lining, which can cause more GI issues. All right, so the second one is so all these NSAIDs are mostly all used for arthritis as anti-inflammatory drug and also for pain. So that's same for all three of these. So diclofenac, or brand name Voltaren, is another NSAID that is also COX-2 selective, but it's not written on your Excel sheet, but it is also another COX-2 selective agent. And itodolec, brand name Lodin, is another NSAIDs that are highly COX-2 selective as well, and also for arthritis or pain. But out of all three of these, celecoxib is the most COX-2 selective agent. That's why it's probably written like that. All right, moving on. The second subgroup I made is opioids. So I'm sure you guys know this well. So first one is codeine plus acetaminophen. So codeine, the brand name is Tylenol with codeine. So Tylenol is a brand name for acetaminophen. So it is opioids, but then there are different classes. So when it comes in tablet, that is C3 drug, so control 3, whereas for liquid formulation, it's C4. And usually the liquid one, a lot of time it's used for cough. Codeine is used can be used for cough, but then overall it's used for pain. So all the opioids meds are for pain. And the second one, fentanyl transdermal patch, or brand name Durazizic. It is a control 2 opioids medication for chronic pain. It's very high highly potent opioids. So really only for chronic pain patients, not really used for acute pain. And hydrocodone with acetaminophen. So when it's combined with acetaminophen, the brand name is Vicodin. But you probably sometimes hear different brand names such as Norco or Lortab. So there can be many different brand names, but Vicodin is the most common brand name for hydrocodone with acetaminophen. And it is also C2 opioids, and it's used for pain. All right, moving on. The next category I have is muscle relaxants. So you may hear sometimes a term such as spasmolytics or antispasmodics. So they are all same. Sorry for misspelling. Okay. So the first one is baclofen, or brand name is Leolacel. And then second one is carisoprodol, or brand name is Soma. And the third one, which is most commonly used for acute muscle pain or spasm, is cyclobenzaprine, or brand name is Flexeril. So these are centrally acting skeletal muscle relaxant. So anytime you see anything that is centrally acting, meaning it works in our CNS, they cause a lot of dizziness and drowsiness. So because of that, these agents are something we need to tell people not to drive or use any machinery after taking them, and also not something we like to give to older patients because of the risk for fall. And also, carisoprodol has some abuse potential, so we like to try to avoid avoid the use of this medication as if possible. All right. So moving on, the next class is anti-rheumatics. So these are the medications we use for rheumatoid arthritis or many other inflammatory disease. So first one is hydroxychloroquine. The brand name is Plaquenil. So was first used for malaria, but also used for lupus or rheumatoid arthritis. And then the second one is adalimumab, or brand name is Humira. So anytime you see these, anything that ends with mab, they are considered as monoclonal antibody. So these are the ones that binds to certain receptor, certain factor that interferes with inflammation process. So you'll learn it more later in D&D modules, but when you see any drugs that end with mab, you can consider them as monoclonal antibodies, and they're extremely expensive. For example, for this particular one, Humira, um, it is about $3,000 for about a month supply. So it's really, really expensive. And the other one, uh, etanercept, or brand name Enbrel. You probably heard of this as well. This is another medication used for rheumatoid arthritis, but it can be used for psoriasis or Crohn's disease. These are all known as inflammatory disease. So this one is not monoclonal antibody, but also working on the same receptor, TNF alpha. You will learn later. So really trying to modify those DNA derived protein. So these medications are known as DMARDs. These all three meds, they are disease modifying rheumatic drugs. So basically, these are the drugs known to slow down the disease progression of rheumatoid arthritis. So you're gonna hear that term later. But hydroxychloroquine, adalimumab, and etanercept, they are all known to be DMARDs. All right, so next class is for gout. There are three drugs: allopurinol, brand name is Xyloprim, and then fevoxostat, or brand name Uloric, and the final one is colchicine, or brand name Colcris. So allopurinol and fevoxostat, they are both considered xanthine oxidase inhibitor, and xanthine oxidase is an enzyme that converts hypoxanthine to xanthine to uric acid. So basically, this enzyme will increase the level of uric acid by converting them finally to uric acid. So by inhibiting this enzyme, we're hoping to lower the level of uric acid. So they are both used for gout or hyperuricemia. And then colchicine is more, this is not ultimately lowering the level of uric acid because it's not really working to stop the synthesis of uric acid. However, it's really more for symptom relief. So it's more like an anti-inflammatory drug that is trying to kind of calm down the inflammation and kind of try to reduce the pain. So a lot of time you'll see allopurinol and colchicine given together because it's it takes some time for allopurinol to start kicking in. So we want to give colchicine at the same time so that patient can get symptom relief while allopurinol start working to lower the level of uric acid. Usually allopurinol is the one that is used first, and then if that's not working, then we can go to Uloric because Uloric is a lot more expensive, whereas allopurinol is really inexpensive. It's available in generic, whereas Uloric, it's about $400 per month supply. So it's really reserved for the second line, as a second line. All right, so last one is for osteoporosis. I think there are going to be more drugs under this category in the next week's quiz drugs. Alendronate, or brand name Fosamax. It is the most popular drugs you'll see in the pharmacy for treating osteoporosis. The class name for alendronate is bisphosphonate. This is a drug class that inhibits bone resorption. So basically, slow down the breakdown of the bones. It does not help to build a bone, but it slow it down. So used for osteoporosis and Paget's disease. So alendronate is gonna be the one that you'll see the most in practice, as it is inexpensive and has shown to be beneficial to prevent or reduce the risk for fractures from fall. All right, so these are the drugs that we just went over. So hopefully this helps you as you study for the drugs for next week's quiz. And feel free to reach out if you have any question.